If you are watching this, you probably already know that feeling. You sit down for an hour, or you wake up in the morning and your feet feel like they are wrapped in cotton. Or there is that pins and needles sensation that starts in your toes and works its way up. Or sometimes just numbness, not painful exactly, but wrong, like your feet belong to someone else. If that is familiar to you, stay with me, because what I am about to show you takes about 12 minutes sitting in a chair, and the people who try it consistently report feeling a difference by the end of the week. The exercises I am going to show you come from physical therapy research on peripheral nerve circulation, work done specifically with older patients who were not responding well to medication alone. What the research kept finding was that targeted movement of the feet and ankles produced measurable improvements in nerve function. The mechanism turned out to be simpler than anyone expected, and the observation that first pointed researchers in this direction came not from a laboratory but from a patient. A 72-year-old retired teacher who mentioned almost in passing that her tingling had improved after she started doing ankle circles every morning while drinking her coffee. That one observation sent her physical therapist back to the research literature, and what came back changed how the whole approach to this condition was understood. The nerve fibers that carry sensation in your feet are the longest in your body. They run from your lumbar spine all the way to your toes. In some people, that is more than 4 feet of continuous nerve tissue. Long fibers are more vulnerable than short ones. They need more oxygen, more blood flow, more consistent movement to stay healthy. And they are the first to suffer when circulation slows, when blood sugar runs high, when you sit still for long periods. What the research showed was that most people with tingling and numbness were not moving their feet and ankles through their full range of motion even once a day. And the research showed that targeted ankle and foot movement significantly increases blood flow to the peripheral nerves, sometimes measurably, within minutes of starting. Sit with that for a moment. The sensation that has been disrupting your sleep or making you worry about your balance may be responding in part to a circulation problem that movement can address. Not fix entirely, not in every case, but address. Here is how Osei explains it to her patients. Imagine the nerve in your foot is like a garden hose that has been kinked. Water can still get through, but not freely. The tingling and numbness are the pressure telling you something is restricted. Movement is what unkinks the hose, not medication, not surgery. Movement done consistently in the right pattern. I am going to walk you through 4 exercises. Do them in order. Do them every day if you can, or at least 5 times a week. Most people see the most improvement in the first 2 to 3 weeks, but the real gains come after 6 to 8 weeks of consistency. Let me be honest with you. If your neuropathy is severe, or if you have diabetes with significant nerve damage, these exercises alone will not reverse everything, but they will very likely help, and they will not hurt. That is a trade worth making. Exercise 1 is ankle circles. Seated in a chair, you lift one foot slightly and rotate the ankle slowly through its full range of motion, both directions, then switch feet. The goal is full rotation, not a small movement. If certain positions feel stiff, that is exactly the information you are looking for. What is happening physiologically? The ankle joint contains small blood vessels and nerve endings that respond to movement. Full range rotation pumps blood into the joint and surrounding tissue, stimulating the nerve endings and increasing local circulation. Clinical observations consistently show that patients who do ankle circles daily for 3 weeks report a measurable reduction in resting tingling, not in all cases, but in most. This next one surprised me when I first learned it, because it looks almost too simple to do anything. Exercise 2 is toe lifts and spreads. With feet flat on the floor, you lift your toes as high as they will go. Try to spread them wide. Hold briefly, then lower slowly. Most people discover immediately that some toes barely respond. That is the point. You are looking for what is not moving. Most people discover that some of their toes barely move independently. That is not a character flaw. It is what happens after decades of wearing shoes that compress the foot and limit natural movement. The small muscles of the foot atrophy. The nerve signals that used to travel easily from brain to toe become slower and weaker. This exercise wakes those pathways back up. Physical therapists often describe it as relearning a language your feet used to speak fluently. Exercise 3 is heel to toe rocking, slowly shifting weight from toes to heels and back in a controlled rhythm. You can rest your hands on your knees if balance feels uncertain. This is the exercise that most directly activates the calf muscle pump. What makes this exercise particularly effective is that it engages the calf muscles, which act as a secondary pump for blood returning from the lower legs to the heart. The medical term is the venous muscle pump. Every time you contract your calf, you are actively pushing blood upward against gravity. For people who spend a lot of time sitting or who have reduced activity levels for any reason, this pump has essentially been dormant. Waking it up increases circulation throughout the lower leg and foot, which is exactly where most peripheral nerve issues concentrate. If this is the kind of information that has been hard to find, subscribe now. I put one of these out every week, and this is exactly what they look like. Exercise 4 is nerve gliding, extending each leg and slowly alternating between flexing the foot toward you and pointing it away. The movement is gentle and held briefly in each position. This is the most specific of the 4 for neuropathy. What you are doing here is gently moving the sciatic and peroneal nerves through their full range of motion within the nerve sheath. Nerves can become adherent, slightly stuck to surrounding tissue when they are not moved regularly. That adherence restricts the nerve's ability to glide freely during normal movement, which contributes to pain, tingling, and numbness. Nerve gliding exercises were developed specifically to restore that natural movement. They are used by physical therapists for conditions ranging from sciatica to carpal tunnel to peripheral neuropathy. The ankle extension component was added because research showed it amplifies the effect for patients with foot tingling specifically. There is something worth knowing about why these 4 exercises specifically in this order, and not the dozens of other foot exercises you might find online. Physical therapists working with neuropathy patients have tested many variations before settling on this sequence. The order matters because of how the body responds to increasing demand. Ankle circles come first because they are low effort and high circulation impact. They warm up the joint and begin moving blood into the area before asking the muscles to do anything challenging. Toe lifts and spreads come second because they activate the small intrinsic muscles of the foot that most other exercises skip entirely. Heel to toe rocking comes third because it engages the calf pump, which builds on the circulation already started by the first 2 exercises. Nerve gliding comes last because it is the most specific neurological intervention. It works best when the surrounding tissue is already warm and the blood moving freely. If you only have time for 1, do the ankle circles. If you only have time for 2, add the nerve gliding. But the full sequence done in order produces a compounding effect that none of the exercises produce individually. That is what the research on exercise sequencing for peripheral circulation consistently shows. Before I let you go, I want to say something directly to those of you who have been managing this for a long time. Peripheral neuropathy and chronic tingling are conditions that the medical system often treats as problems to be managed rather than problems to be improved. You are handed a prescription or a pamphlet and told this is just something you live with. That framing is not always accurate. Movement interventions for nerve health are well supported in the research literature. They are not alternative medicine. They are physical medicine, and they are underused, partly because they require patient effort and are harder to prescribe than a pill. The research shows that the most important factor in outcomes for peripheral neuropathy is consistency, not intensity, not duration, consistency. 12 minutes a day, 5 days a week, over 6 to 8 weeks, consistently outperforms sporadic longer sessions in study after study. That is genuinely good news, because 12 minutes in a chair while your coffee brews is available to almost everyone. One more thing, and this is the most important practical point. Do these exercises with your shoes and socks off if you can. Barefoot or in socks without shoes allows your feet to receive full sensory feedback from the floor, which engages the balance and proprioception systems simultaneously. It makes every exercise more effective. Put your feet flat on the floor right now. Take your shoes off if you are wearing them. Feel the floor under your feet. If you cannot feel it clearly, or if the sensation is muffled or strange, that is the baseline you are working from. Do these exercises consistently for 3 weeks, and then take note of what has changed. Most people notice it in the morning first. The first steps out of bed start to feel different. That is the nerve circulation improving. That is the signal getting through more clearly. The sensation in your feet is trying to tell you something. These exercises are how you answer it. This video is for educational purposes only and is not a substitute for medical advice. Please consult your doctor about your specific situation. I will see you in the next one.